without further ado, I would like to introduce Priya. Priya Narayan, she is a highly experienced clinical orthoptist, having worked at several tertiary referral hospitals, private ophthalmology clinics, and low vision services. More recently, Priya has worked as an educator at the University of Technology, Sydney, and is currently working as the Healthcare Practitioner Program Manager at MDFA. Priya's specialised areas of interest are low vision, paediatric and adult neuro-ophthalmology, and education. So I'd like to introduce Priya right now, and she will be taking you through the rest of the webinar. Hi Priya, how are you going?
Delaney, I'm really well, thank you.
That's great. Okay, so I'll let you go ahead.
Thank you. Hello everybody, as Delaney mentioned, my name is Priya and I'll be presenting this webinar to you this afternoon called Staying Safe at Home with Vision Impairment. Before I jump in, I just wanted to let you know that the information that I'm presenting is really general in nature, so I'm not targeting a particular macular disease or a particular level of vision. You may be implementing some of the things that I talk about already at home. That's fantastic. And you may also have some comments for me regarding some ideas that you are doing that I haven't presented, and I would love to hear from you. I also hope that there are some new bits of information in here that you may not have heard of before. So the agenda for today. First of all, I'll discuss with you what functional vision is and why functional vision is important in individuals with a vision impairment. Then we'll talk about how to minimise hazards within the home, some tips and ideas about reducing the risks of slips and falls and trips. Then we'll talk about the importance of lighting at home. And then if you've had some trouble locating knobs, buttons or dials, I'll also talk to you about how you can mark appliances as well as remote controls for easy navigation. And then we'll discuss some low vision gadgets and devices that I've found useful in my practice with low vision clients. And then I'll pass you back on to Delaney, who'll talk to you a little bit about the role of the Macular Disease Foundation Australia. And then we'll both come together and answer your questions. So we'll get started. Functional vision. So during my work as an orthoptist working for low vision services, I was often asked to write reports about what an individual could or could not see and how they perform their activities of daily living, and also how much their vision impairment impacted on their independence and on what sort of equipment or services or gadgets would help them stay independent. So when we normally speak about vision, and if I say to you, let's have a look at your vision, most of us automatically think about the vision chart or the letter chart. And I'm sure we've all seen the letter chart once or twice in our lives. This is, of course, a gold standard test in eye care, or one of the gold standard tests. And it's a fantastic way for clinicians to monitor disease progress as well as stability. It's also looking at the effectiveness of treatments like injections, laser, and eye drops. But generally in life, we don't see in black and white, and nor do the light levels stay consistent and constant throughout the day. That's why it's really important to consider functional vision. So what is functional vision? So it really is all aspects of an individual's vision, and it is defined by the way an individual uses whatever level of vision they have to perform everyday activities and tasks. So these activities can include, but are not limited to, of course, reading, catching public transport, as well as cooking. So in the next few slides, I want to show you some of the clinical components of functional vision, so how your eye care practitioner will test for it in the clinical situation. But more importantly, I also want to show you how this relates to real life. So first of all, colour vision. The ability to see colours can be dramatically reduced by macular disease. This image is of a clinical test called an Ishihara colour vision test, and it's used by eye care practitioners to determine whether someone has hereditary colour vision loss. This test does help eye care practitioners also understand the type of colour vision loss an individual has and also the severity. and it's based on a person's ability or inability to see numbers, shapes, or patterns hidden in these plates. But in real life, beg your pardon, colour vision loss can look something like this. So these two images are mimicking. On the right-hand side, we've got an image that's mimicking normal vision. And on the left-hand side, we've got an image that's mimicking macular disease. So comparing the two. So the right-hand side, normal central vision, even though the light levels are quite low, you still can make out the blue of the city skyline. You can still see the twinkling lights and also the different colours of the twinkling of the lights as well. On the left-hand side, because of macular disease, the details are missing, but more importantly to this point, colour vision is also missing. Some macular conditions can lead to a complete absence of colour as well. We're going to move on to contrast sensitivity, and I personally love the contrast sensitivity test. I think it's really important to do on patients who are have a vision impairment, also patients that have normal vision as well. Contrast sensitivity literally means the ability to make out details in different light levels. This is an image of a clinical test called a Visitech, which can be used by eye care practitioners to determine a person's contrast sensitivity levels. But more importantly, it can tell you whether a person is having trouble in a particular light condition, say if the light levels are low, or if or they may be having trouble under sort of brighter light conditions. Reduced contrast sensitivity causes the difficulties in making out edges and outlines, can also cause changes to vision with fluctuating light levels. So in real life, some really good examples of contrast are stairs and steps, as well as curves. So when you're crossing a road and stepping up on the curve. So I've got two images again here. On the left-hand side is normal vision, and right-hand side is someone that's got severe contrast sensitivity loss. So on the left-hand side, in my opinion, the contrast is quite poor because you've got grey on grey steps. It also seems like it's quite an overcast day. But if you've got normal vision, you're still going to be able to make out the individual steps and the edges, and you'll be able to ascend and descend those steps quite easily and safely. So on the right-hand side, like I said before, it's showing poor contrast, and you can see how the steps are actually blending into each other, and so you're not able to make out each individual step. And even though the light levels are actually quite good, this can be quite dangerous and be a false risk for someone who's unable to see each individual step clearly. So we'll talk about sensitivity to light now. So some diseases of the macula do cause severe sensitivity to daylight as well as artificial light. And this sensitivity, of course, has a flow-on effect of reducing a person's vision. Sometimes the impairment can be so severe to an individual that they may need to wear tinted glasses or even sunglasses inside their home. So to summarise this part of the presentation, I really wanted to highlight that vision impairment is far more than a person's ability or inability to see letters on a letter chart. You may have experienced a time where you've gone to see your eye care practitioner and they've said they're really happy with your vision or that things are really stable. Wonderful, you say, but I still can't see the TV. It still takes me ages to get used to or ages to see if I'm coming from outside to inside the house, or I have to hold my watch all the way up here and use a really bright light just to see what time it is. So that's functional vision. That's how we use our vision daily. All the individual components of vision impact how an individual stays safe within their home and also in accessing their community. All these components of vision come together to play a crucial role as an individual goes about their daily life. So in the next part of the presentation, I'll give you some ideas and tips around increasing safety within the home, as well as ideas on how to bump up and support your functional vision. So we're going to start off by talking about hazards and how to avoid common hazards within the home. 1 in 3 people over 65 years of age do have a fall in a given year. There is a large body of evidence that strongly links vision impairment to poor balance, mobility problems, and an increased risk of falls in the older age group. Now, I'm going to list some simple ideas that can help an individual with vision impairment reduce the hazards that can cause a trip and fall, and some of these things that you probably are already doing at home, which is fantastic. So removing non-essential items like loose rugs or magazine racks, side tables, removing trip hazards from entryways like shoes. So the take-home message here really is to declutter. So any short or difficult to see furniture is a trip hazard and it's probably best to be put away. I just want to draw your attention to this image that I have here on the slide. It is an image, it looks like it may be a young person or a teenager's bedroom. The point I was making here is that, I mean, that's really clutter. But there's so many things on the floor that you can't even see the floor. And that is, of course, a big trip hazard. But for someone that's got a visual impairment, even a one small thing left lying on the floor can cause a significant fall or a trip. So removing these sort of hazards off the floor brings me to the next point, that furniture should also be positioned in a way to provide really easy navigation for an individual with a vision impairment around their home. And I've used this image here of one of those electronic vacuum cleaners that go about their business cleaning your home. The vacuum cleaner needs a wide berth and needs enough space to move around between furniture so it can do its job. And similarly, someone with a vision impairment needs to have clear, easy pathways, even within the home, to navigate from one part of the house to the other safely, especially in those really high use areas like kitchens, going to the bathroom, going from the living room to outdoors as well. Extension cords and cables, as you all know, pose a trip and a fall risk as well. These can be kept tidy by using those zip ties as well as using tape, like this photograph is showing you here. If you are going to use tape, it's really important to try and find the non-slip tape, and also tape that grips onto the surface that you'll be sticking onto. Not all would grip onto carpet. It's also really important to remind visitors and caregivers who are coming into your home to put items they may have moved back to where these items belong. And also to ensure that pathways and walkways are clear of items such as shoes, bags, and any other equipment they may have brought into your home. So we'll talk about home modifications now, like railings. These can be fitted into many areas inside as well as outside of your home, and they do provide safety and mobility and try to aid in reducing falls. They're especially in really high risk areas like steps, as well as within the bathroom. You can imagine with the bathroom, you've got tiles that can be slippery, wet surface can be quite dangerous. So also removing slip hazards like loose mats from bathrooms can also aid in trying to reduce the risk of a fall. I do really like talking about steps. They really are a hazard, especially if your contrast is poor. So because they can pose frequent hazards to people with low vision, because they can blend into each other, contrasting edges placed on steps can assist with improving contrast, and how this does that is by highlighting each individual step. So to be effective, a contrasting strip needs to be placed on the tread, and that's where you would put your foot over here, as well as the riser. So that's the part that you can see maybe here when you're looking directly at the steps. So, and this is so that you can see the contrasting edge when you're climbing up the steps as well as going down. There are a couple of options when you're going to try and put contrasting edges on. There is paint or paving paint. It's those slip resistant paint and paving paint. They ensure that one, non-slip, and also that there's a good grip onto the surface. And another way you can put the contrasting edges on is using slip-resistant adhesives. In this particular case, there was a grey stairs, so grey on grey, and what they've chosen to do is change the background of the stairs to black and using yellow contrasting edges, which makes it really easy to see. But my advice would be to have an assessment by a low vision service, because they'll be able to provide you with detailed guidance about which particular type of edging and to use for indoors versus outdoors. They'll also be able to tell you how wide the safety strip or the contrasting edge needs to be, because there are guidelines around that. So the guidelines say there should be about 50 to 75 millimeters. And also the low vision service will be able to tell you which particular colour would be best to suit the vision impairment a person has, as well as the level of vision the person has as well. Vision impairment can also make electrical sockets difficult to see because they blend into the background. Aesthetically, that looks really nice in a home, but if you've got a vision impairment, it can be really difficult to locate switches as well as electrical sockets. So using a contrasting colour that draws your attention to the wall sockets, it's a really good idea. So I've got two methods here that I found really useful. So the first one is to change the colour of the sockets so that they really stand out from the background. And of course, you would choose a colour that the individual with a vision impairment can see. Another method is using electrical tape. They do come in lots of different colours. And so what you would do is just pretty much tape around the wall socket or the light switch, again, bringing attention to that part of the wall. So low vision services can perform safety assessments within an individual's home. They advise about equipment or installations like railings for safety. And I'll provide a little bit more information about low vision services at the end of the presentation. Before I keep going, how you all going? I can't hear or see you, but I'm hoping that you're finding the presentation interesting so far and you've learned something. Next part of the presentation is going to, and thank you for your attention. So the next part of the presentation is going to be about lighting. You all probably know what a crucial role lighting plays in a person's safety within the home, especially if they've got a vision impairment. But what you may not know is that an individual with low vision can need as much as 2 or 3 times the amount of light as compared to a normally sighted person. So lighting is separated into 2, so overhead, also called general ambient lighting, daylight falls into this category also, as well as task lighting, which is a really fancy way of saying lamps. So we'll talk about daylight. So do you find yourself gravitating to a sunny spot when you're doing your reading or your close work? Daylight is an important source of light that a lot of people with vision impairment do find useful. I've got some suggestions here to maximise the use of sunlight, and I'm sure a lot of you are doing this already. So first of all, keeping windows as clean as possible, and this is to, of course, ensure the maximum amount of light comes into your room. So, and also making the best of daylight hours by adjusting the time that you do some activities. For example, meal preparations like chopping vegetables, if they could be done maybe between 12 and 2 when the sun is at its strongest rather than at 5 p.m. Glare can reduce vision immensely. So to reduce glare from the sun, work with your back towards the window. And of course, as you all know, blinds and curtains are a great way to get rid of or reduce unwanted glare. So we'll move on now and talk about overhead or general lighting indoors. Good overhead lighting is important due to how much daylight varies day to day, hour to hour, different weather conditions, different seasons. Generally, fluorescent lighting is recommended for general lighting in the home or school, especially with people with vision impairment. The reason for this is the tubes produce a diffuse light, so it reduces shadowing and glare. They also provide a really bright light as well. And the great thing about fluorescent tubes is they can be used indoors and outdoors. And we're lucky these days because they come in warm and cool colours too, so different atmospheres for different rooms. A good tip with lighting is to keep indoor lights on during the day. So lighting is equal or very similar from one room to another or from indoors to outdoors. This is really used to reduce extreme changes in light that can cause disorientation. And of course, there are some individuals with a vision impairment that have a lot of difficulty adapting to the changes of light. So this is helping to eliminate or reduce the amount of time it takes to get used to a change of light. You also should if you are turning a lamp on to do some reading, surrounding light should also be turned on. And this is again to ensure consistent light levels within a room. So if you get up from your reading and go to another part of the house, the changes in light conditions don't cause any disorientation. Going to the bathroom can be disorientating for everyone, whether you have a vision impairment or not. It is really important to turn on overhead lights or night lights. I know it sounds really simple, but you'd be surprised. Some people get concerned about waking up other members of the family or that they're using unnecessary electricity. So we're going to move on to task lighting now. I'm sure you've noticed that overhead lights can produce shadows on furniture as well as on or shadows from partitions. So at certain parts of the day, the sun is also so low in the sky that it does cause uncomfortable glare. So sometimes daylight and overhead lights are insufficient or they just don't cut it. So, and ceiling lights, even if they're nice and bright and you're using a fluorescent tube, they're a bit too far away to provide adequate lighting for up close or detailed near tasks. So this is when task lights like lamp really come into their own. They're really useful, and they're really useful because they enhance contrast. They're really great for reading, writing, craft work, chopping vegetables, and are best used with overhead lighting on, as I've mentioned previously. So lamps, choosing a lamp is really important as well. I love this one because it's got an adjustable arm and a wide shade, and I'll explain to you why that's important. So this lamp has got two bends, one here and one here, and that will allow you to move the light really close to your reading task as well as angling it as well. And the wide shade is great because it allows the globe to sit well back within the lampshade. So the reason behind this is it's trying to reduce glare. So any excess light that's coming out of the globe sort of gets captured by the shade, and so it doesn't go into your eye. I'm going to talk about how to position a lamp when you are reading, and I'm fully aware that everybody's got their own techniques and methods. And if it works for you, go for it. This is just an idea, and I'll tell you why I prefer this setup. So positioning the lamp, first of all, below eye level. So I'll just orientate you to this photo first. So you've got a person here with a pair of glasses. They're reading a book, looks like a very big book, at about 30 centimeters away. So the lamp is sitting below eye level. So again, the light isn't shining into the person's eye. It is angled at about 45 degrees. So if this is straight ahead and this is to the side of the person's eye, it's sort of in between the two. And the premise behind that is that the light rays would hit your reading material and bounce off to the side and be well outside of the reader's view. So again, reducing the chances of glare getting into your eye. Generally in low vision, we do recommend LED lights because they produce a really white, bright light. So we'll talk a little bit about magnifiers now. We're really lucky because these days most magnifiers, especially optical ones, the handheld ones, have an internal LED light, which is really useful because it reduces the need to have a lamp at times, and also it's portable, so you can take it shopping, take it to a friend's place and not be worried that you won't have adequate lighting to do any reading. But if you prefer to use a lamp with your magnifier, or if your magnifier doesn't have an internal light, in the next slide, I'll explain to you how you can potentially set yourself up. So same picture as what we used previously. So we've got a person here looking at their reading task, and again, about 30 centimeters away. Their handheld magnifier is sitting about 5 centimeters away from their reading material. The lamp, again, is below eye level and is angled at about 45 degrees. The most important thing here is the light from the lamp is hitting the book behind the magnifier. And the reason for that is that if the light's actually hitting the magnifier, you'll get a lot of distortion and glare, and that would not be comfortable for reading. And again, the way it's angled, the light rays bounce off from the book off to the side and completely avoid the person. We're going to move on now to marking appliances. Have you ever had trouble finding the correct button on the remote, or have accidentally pressed 30 minutes instead of 30 seconds on the microwave? A lot of my low vision clients have stated that appliances can be really frustrating to use, especially if your vision fluctuates or is sort of slowly deteriorating, which a lot of macular diseases can, which is common, in a lot of macular disease. So one of the most common things that I've heard is identifying correct dials, buttons, and switches, and also not knowing when the desired setting has been reached. So if this is the case, colour and tactile markers are a fantastic way to get around it, and it's when used with really good lighting, they can really improve the navigation of appliances and remotes. I've got some examples of markers here. So the first one is bumps or tactile dots, so they come in different colours as well as different sizes. I've got puffy paint here as well, and I'll show you sort of in the next slide how you could use that. And my favourite, because it is cheap and cheerful, so felt floor protectors for furniture. They're great because you can cut them into different shapes and sizes. So let me show you how this can potentially be used. These images, so the setup for each of these images is very personal. So the person who decided that this is going to work for them, it works for them. So everybody is very different in what they like. So now I'll quickly go through it with you. So the photograph on the top left-hand side, this is the microwave, and the individuals used a combination of circular and rectangular tactile dots, and also dots of different colour. So different size circular dots highlights at a start button, a smaller one circular dot highlights another mode, and smaller still circular dots highlight the numbers on the microwave. There's a really large rectangular marker that highlights another mode on the microwave, and a smaller rectangular marker that marks or highlights the off button. On the right-hand side is an example of how puffy paint can be used. So this is an oven, and so what the individual has chosen to do is to put the paint around the bake function, so a rectangle around that, and a circle around the stop function, and they've also highlighted arrows for up and down for temperature and time. And the bottom image is using those felt furniture protectors, a really large one for one of the functions down here, and a smaller one to turn the oven on. We'll move on to the remote control. So sometimes it can be really useful to tape over or hide buttons or dials that are not being used, especially in remote controls and VCR remote controls as well. Remote controls, the TV and the VCR. So the first picture, the first image is of a VCR remote control, and we've taped over all the buttons pretty much. The only thing remaining is the on button and the play pause button. And similarly with the remote control, we also completely taped over the majority of buttons, just leaving the ones that are useful, the ones that you use the most visible. So the on button, programs up and down, as well as volume up and down. So if you are marking appliances or if you're covering buttons, it's really important to have a go practicing a few times before with the person who's helping you mark them as well, before you use them independently. And that's to make sure there's no mistakes or any accidental misuse of appliances as well. And another tip with marking appliances is that make sure you only mark the buttons or the functions that you use all the time, and that's to reduce any confusion. So this is the favorite part for me of this presentation, useful devices. Low vision services can help provide a whole range of useful gadgets and devices for an individual with vision impairment. Now I thought I'd go through some of my favorite. I like these devices because they're really simple but play such a crucial role in keeping an individual safe as well as independent within their home. So the first one is a talking watch, which is self-explanatory. It looks like a proper watch. It does exactly the same things as a proper watch or a normal watch, but with the press of a button, it'll tell you the time, it'll tell you the date, and it'll tell you the day as well, which is very handy. On the right-hand side is an image of a liquid level measure. And what this does is it sits on the inside of a mug or a cup, and it will beep or make a noise once the liquid hits a certain level. And it's best, or you can use it with cold water, but really what it's used for is for hot liquids. And this is to stop any overflow of hot liquid, which can cause burns and injury. The image in the top left is of wraparound sunglasses. So I just want to say that if you had sensitivity to light, especially when outdoors, it's so important to invest in good fitting sunglasses. These are really good because they're wraparound, so they sit all the way around and they sit securely around your eye. They also provide protection from the light entering in lots of different areas, so top, down, and the sides as well. These are good because they're big, so they can be placed on top of normal distance glasses if you do wear them. The image on the right is of a color detector. So if you are having trouble seeing colors or identifying certain shades, this can be great, especially if you're having some trouble laying out your outfit for the day. This is my favorite, the big button phone. I love it because it's so simple to use. The numbers are large and the individual number pads are so big that it sort of tries to reduce the chances of misdialing, and it can be used successfully even with individuals that have fine motor issues. So even if fingers are arthritic, you can still navigate the number pads quite easily. Tactile dots that I showed you in the earlier slides can also be placed on the zero, and this is great for easier identification, especially in emergencies. And the last device I want to show you is a sloping board. So sloping boards can come in different sizes and also use different materials. This is a wooden one. And this young person is using their sloping board doing some schoolwork with their magnifier. The great thing about the sloping board is that it sort of reduces your need to hunch over and look over documents or a book, especially if you're using a magnifier as well. I can imagine that it would be quite difficult. Sometimes it will cause strains, neck and back strain. So the sloping board brings your reading material to you, and so you can sort of enjoy longer periods of reading without discomfort. And we're coming to the end of the presentation, so I just wanted to touch on low vision services. There are some services like Vision Australia and Guide Dogs that are national, so they service lots of different states. There are other low vision services like Visibility that only service certain states. So Visibility does Tasmania as well as Western Australia, and the Royal Society of the Blind does South Australia. So what do low vision services do? So a low vision clinic provide really valuable individualized services for adults, young people and children with a vision impairment or blindness. And of course, their carers, families, schools, community members as well. So these services can help you understand how to make the most of your existing vision. They teach and prescribe the best optical or electronic devices that can help you read or perform near tasks. They assist you to remain independent at home through the use of services, devices, and technology. They teach you how to use technology for home, work, study, as well as play. They teach you how to access the community independently, even as well as, and this includes catching public transport by yourself. And some wonderful services have talking book libraries as well as employment assistance as well. So this does bring me to the end of my presentation. I thank you so much for your time. I will pass you back to Delaney now, who will go through the role of the Macular Disease Foundation Australia with you.
Thank you so much for that, Priya. That was very, very informative, and I think I definitely learned a lot, and I'm sure most of you did as well. Just a reminder about the questions. So, like I said before, on the right side of your panel, you should be able to see a couple of icons. The fourth icon has that speech bubble with the question inside. Just click on that, and then if you go to the white rectangle at the bottom, you can type your question in there and then press send. Like I said before, no one else will be able to see your questions apart from myself and Priya, so please don't be afraid, just send them through. Before I do move on to the questions, however, I did want to talk quickly about the Macular Disease Foundation Australia and the services that we provide. We have a number of pillars of work, the first being education. We provide current, ongoing, and accurate information to all members of the public and those who have macular diseases as well. Last year, we reached over 7,000 people all around Australia, and that was something that we were very, very proud of. We also work to try and increase the awareness of macular diseases in the country, trying to get more and more people getting regular eye tests and learning about the services that are available to them. Client services. So this is how we provide help to our clients. I will talk a little bit about this in a moment. Advocacy. So we actually have a whole advocacy department at MDFA who work in the best interest of the macular disease community, advocating to the government. Some of you may have heard about the MBS report that was released last year. There was quite a lot of work that was done regarding that. If you would like more information on that, you can contact us and we will let you know everything that has been done. And of course, research as well. 100% of funds donated to research actually go straight to our research grants program. And we've donated over $4 million now to 18 different Australian research projects since 2011. And finally, fundraising. Of course, none of this would be possible without the generous help that all of you have given over the past couple of years and over the, well, since 2011 and beyond. So I would like to take this opportunity just to say thank you. All of this is possible because of you. Now, this is how we can help you. So on the screen there, you'll be able to see our helpline. That's 1-800-111-709. So not just for help about how to stay safe at home with low vision, but if you had questions on age-related macular degeneration or perhaps diabetic eye disease, perhaps you have questions about Medicare, how the extended Medicare safety net works, or perhaps you want to know about My Aged Care. Those are just a couple of the things that we can help you with. If you're sick of hearing my voice or Priya's voice, which I'm sure some of you are, you can instead go onto our website. That's www.mdfoundation.com.au, and all of our resources are available there. And we don't charge for anything at all, so you can order whatever you'd like and have it posted or emailed to you. If you do have any questions, like I said, you can put it in that panel on the right side. If you have any questions after the webinar, you can email us at education@mdfoundation.com.au. So now I might just go over to some of the questions that you've been sending through. There's actually quite a few that are coming through, which is really great. I might have Priya come back on so we can so she can help with those questions as well. So one of the first questions was, does glare sensitivity necessarily mean that you may have macular degeneration?
No, there are lots of different eye conditions that cause glare sensitivity. For example, cataracts are one of the most common. Sometimes when people have issues with the front part of their eye, the cornea can also cause glare sensitivity. I know lots of people who have very fair colored eyes who are also glare sensitive. So it's very important to wear sunglasses to protect our eyes, but the sensitivity to light doesn't necessarily equate to macular disease.
Okay. We have another question as well. Would you recommend using a warm light or a cool light?
Great question. I personally love warm light. It just makes you look younger. But it's very, very personal. It's whatever works best for you. So a lot of the time in clinic, we have very cool lights, and that's because it's very professional. Warm lights make you feel or look sleepy. So it is very individualized. So whatever you prefer, there's no rules around that.
Okay. Another question, where can you get the stickers and the puffy paint?
So the puffy paint craft shops or online. The stickers definitely from Low Vision Services. I haven't actually seen those stickers available anywhere else.
Okay, perfect. And those Low Vision Services are around the country and are state dependent as well. So you can contact us and we'll let you know where you should go. Yeah. And another question, where can I get those sunglasses? Will they block my side vision?
Yes, so the ones that I chose are very heavily tinted, but the tint changes. So that's a really dark tint. There are lighter versions of that. There are also different colors as well. So you would try quite a few and then pick the one that's best for you. And that pair of sunglasses came from a Low Vision Service, because those glasses, they're called fit overs. They're meant to sit over distance glasses, and they're to provide really high quality sun protection. So again, they're available at Low Vision Services, and the tint can vary, and you choose the one that's right for you.
Okay. Another question, how much do Low Vision Services cost?
So Low Vision Services, I'm speaking personally from the service that I worked for. Most of the services were covered either by government or by funding like NDIS or My Aged Care. If you're not an Australian resident or citizen, then you'd be paying for that service. But the ones in the different states may be a little bit different in terms of funding. So it would probably be best to speak to them personally.
Okay. Perfect. Yeah. Another question, sorry, there's a lot of questions coming through, so I might just pick the most common ones. Is Charles-Bonnet syndrome common in the low vision area?
Yes, it is. That's a short answer. It comes in different shapes and forms. Sometimes people have it constantly, sometimes intermittently, sometimes it can be just random, happens and then doesn't happen again, but it is very common.
If somebody is going through Charles-Bonnet syndrome, you can definitely give us a call or send us an email through. We do have fact sheets available, and we can sort of take you through some tips on how you can try and temporarily disrupt those images as well. So please reach out to us. We can definitely have a chat with you. Another question, do colors make a difference depending on your eye condition? So I'm assuming they mean maybe their perception of colors.
Yeah. Say that question again, sorry, Delaney.
Sorry, do colors make a difference depending on your eye condition?
So do colors make, as in like what colors work best for you?
I think that's what the question means.
Yeah, there are some eye conditions where a particular color works best for you because the person may have a lot of light sensitivity. So I'm thinking about sort of those hereditary genetic macular conditions, but it really is personal. So For example, working in low vision, if I'm working with someone who's looking at, say, an electronic magnifier, and you may have two people with exactly the same eye condition and very, very similar levels of vision as well. One person may love black writing on the yellow background, another person may like white writing on a black background. The contrast is very personal. So I've not in my practice been able to figure out that this condition works best with this particular color combination. It's really personal.
Okay, I think the person that asked that question actually just clarified. I think they were talking about colors in sunglasses, but I think the same statement applies. It's quite personal.
Yeah.
Mm. So we should have explained a couple of questions coming through. What is Charles-Bonnet syndrome? We didn't actually explain what that was. So yes, the questions were, what is Charles-Bonnet syndrome?
Yeah, so simply put, Charles-Bonnet syndrome is a syndrome where somebody that has a vision impairment has visual hallucinations, and these hallucinations can seem incredibly real, and they can be scary at times. They can disorientate you. They can occur at any time during the day. They do even occur with some individuals that have complete loss of vision as well.
I have spoken to some people with Charles-Bonnet, and the images that appear can vary as well. So I've spoken to some people who see brick walls come up. Some people see dragons and fairies when they're taking, going for a walk. I've seen some people say that they can, I did a talk where someone said they saw a snake around my neck when I was talking. So a huge range of images can appear. And I think the thing to note there is it's not a psychological condition at all. It's nothing to be afraid of. It's just your brain responding to a change in your vision. And a couple more questions as well. How come spectacles don't help my age-related macular degeneration?
So glasses or spectacles are used, so it's a technical term, but refractive causes of changes in vision. So the way your eye is shaped, or the way the front part of your eye is shaped. So it's really trying to clear, give your eye and your brain a clear image. But with macular degeneration, unfortunately, because the macula is damaged, doesn't matter how clear the images or the stimulus we're sending to the eye and the brain, because those cells that sort of the cells that oh, sorry, I lost my train. The cells that process those images or those sensory the light are damaged. So it doesn't matter how clear the light is hitting your eye, because those cells are damaged, they're not able to actually process exactly the vision or the light that's coming into your eye. I'm so sorry if that didn't make sense. It made sense in my head.
No, I think we understood what you meant. Yeah. And then second last question, what's the difference between an optical magnifier and an electronic magnifier?
Sure. So optical magnifiers are the ones that you use, the spy glasses like ones that you see old-fashioned detectives use. So they are handheld. Sometimes they have an internal LED light in them as well. They can change in terms of the amount of magnification. So you can start off with a ×3 all the way up to a ×12. But the magnification itself doesn't change. It will always stay the same. And the window, or the where you look through, the smaller the magnification, the bigger the window, the bigger the magnification, so say a ×12, a very small window. Electronic magnifiers are, as the name suggests, electronic, so they need to be charged. They're great because they change in magnification, so they can start off with a ×2 all the way to a ×20 even. And also what they're great because they can change the background of a print. So if you're, say, for example, looking at the newspaper but prefer a more contrast, you can press a button and it'll change the contrast to black and white and 100% contrast.
We had a couple of questions asking about the cost of some of the devices that you talked about. I think if somebody wants to know the specific cost, I think it might be best to contact us individually so we can go through some of those devices. We don't sell any of those low vision aids ourselves, but we can definitely point you in the direction of the organizations that do. And then the last question we have is, what happens at a low vision assessment?
So with a low vision assessment, the clinicians that you see there usually will spend a little bit more time with you than when you see your eye care practitioners like an ophthalmologist or an optometrist in clinic, only because they want to get to know exactly how you use your vision and what parts of daily living or skills or daily activities that you're struggling with. So, and then you sit together and so work out a plan of what your goals are. So you can spend about an hour to an hour and a half with the first person you see. Where I used to work, you'd see the orthoptist first, so you'd have a really long conversation about what things you're struggling with, what you'd want to improve, and then we talk when we do an assessment. And the assessment would be a lot of functional vision assessment. So we'll do a lot of the clinical tests that I went through earlier, but also how that clinical result translates into real life and what particular activities you're having trouble with. And then then you talk about equipment. You see a whole range of individuals maybe in a day, so you might see an orthoptist as well as occupational therapist as well.